Can STDs impact fertility? Let's talk about it. STDs can impact fertility when they are left untreated for too long. And this is because they can both damage the male reproductive tract and the female reproductive tract. Two of the biggest culprits here are chlamydia and gonorrhea. They are two of the most common bacterial infections. These infections typically start in the cervix, but if they're left untreated or not treated in time, they can travel up into the uterus and fallopian tubes, and this can lead to a condition called pelvic inflammatory disease. Pelvic inflammatory disease is a serious infection. It can cause inflammation, scarring, and even blockages in the fallopian tubes, and this can make it difficult or even impossible for an egg to meet sperm. Just FYI, side note, STDs can impact male fertility as well. There are other STDs that can impact fertility or pregnancy, childbirth. You can read more about them in our article about STDs and fertility. One thing to keep in mind is that STDs like chlamydia can often be silent infections, meaning that you're asymptomatic even if you have it. Gonorrhea can also cause mild symptoms that can be mistaken for other types of infections like a yeast infection. So there are a few things to keep in mind to just make sure that if you do get an STD, you can get treated quickly and properly. So get regular STD tests. Practice safe sex, use protection, know your partner's status, seek treatment immediately if you do test positive for an STD or STI. And then there are vaccines available for some STDs like HPV and hepatitis B. And this is not to scare you. If you have the question, can you get pregnant after getting an STD? The answer is yes. Many women who have had an STD are still totally able to conceive without any problems, especially if the infection was caught early and treated properly. What you want to be mindful of is trying to prevent that STD from leading to pelvic inflammatory disease or creating any scarring in the fallopian tubes. In that case, it may take longer to get pregnant or require medical intervention such as IVF or surgery to remove scar tissue.